Understanding the distinctions between persistent depressive disorder and generalized anxiety disorder is crucial for your licensing exam. These two conditions often share overlapping symptoms, which can make accurate diagnosis challenging. By clearly identifying their unique features, you'll be better equipped to answer exam questions and provide effective care in clinical practice. Focusing on the subtle differences will help you avoid common pitfalls and ensure you meet the standards expected in your profession. Persistent depressive disorder, or PDD, is defined by clear criteria in the DSM that are crucial to understand. One of the most important aspects is its chronic nature. Symptoms must be present for at least 2 years in adults or 1 year in children and adolescents. The diagnosis also requires a depressed mood for most of the day, more days than not, along with at least 2 additional symptoms such as poor appetite, low energy, or low self-esteem. It's essential to rule out other causes, like substance use or medical conditions, before confirming PDD specifiers, such as the presence of pure dysthymic syndrome or intermittent major depressive episodes, help further characterize the disorder. Generalized anxiety disorder, often referred to as GAD, is defined by specific criteria outlined in the DSM. One key aspect is that symptoms must persist for at least 6 months, with individuals experiencing excessive worry that is difficult to control. This worry often extends to a variety of topics, not just one area of life. Physical symptoms, such as restlessness, fatigue, and muscle tension, frequently accompany the mental distress. It's important to recognize that GAD can sometimes be mistaken for simply being a worrier, but the impact on daily functioning sets it apart. Persistent depressive disorder and generalized anxiety disorder share several important similarities. Both conditions can be long-lasting, often affecting individuals for years, and significantly influencing their daily routines and overall well-being. Common symptoms include ongoing fatigue, trouble sleeping, and difficulties with concentration, all of which can strain personal and professional relationships. It's not unusual for clients to feel uncertain about which diagnosis best describes their experience, given the overlapping nature of these symptoms. Recognizing these shared features is an important step in understanding and supporting those affected. Persistent depressive disorder, or PDD, is primarily characterized by a long-lasting low mood that colors most aspects of daily life. In contrast, generalized anxiety disorder, or GAD, is marked by ongoing and excessive worry about a variety of topics. Clients with PDD might describe feeling down or hopeless for years, while those with GAD often talk about being unable to control their worries, even when there's no clear reason. Listen for differences in cognitive focus. PDD centers on negative thoughts about oneself and the future, whereas GAD revolves around anxious anticipation and what-ifs. Physical symptoms can also differ, with PDD leading to fatigue and sleep issues, and GAD often causing restlessness and muscle tension. As you prepare for your licensing exam, focus on the essentials that are frequently tested. Pay close attention to duration requirements for each diagnosis, as these often differentiate similar disorders. Be familiar with the key symptom clusters and how they typically present in clients. Watch out for common pitfalls, such as confusing overlapping symptoms or misapplying diagnostic criteria. By keeping these strategies in mind, you'll be better equipped to navigate tricky questions and avoid mixing up similar diagnoses.